Thank you so very much for attending today's event to highlight an important decision that our state representatives and senators have to make that could provide health coverage to over 26,000 veterans in Ohio, including guardsmen and their families. It is fitting that we gather today at the Ohio Veterans War Memorial on the heels of honoring our veterans last week. My name is Frank Miller Jr., and I am a Marine veteran and commander of American Legion Post 315 in Cleveland, Ohio. I am proud to represent my fellow comrades who serve their country and help those who have returned home or served stateside and are experiencing failing health because of the lack of coverage. We can help them by proactively providing coverage. We can save costs through disease management, mental health care, and preventive care. Ohio legislators need to take action now to extend Medicaid coverage. Do not delay. Medicaid expansion is supported by the Military Officers Association of America, AMVET, Vietnam Veterans of America, Military Order of the Purple Heart, the Marine Corps League, Hoorah, Korean War Veterans Association, Catholic War Veterans, Jewish War Veterans, Women's Veterans Committee, and Ohio National Guard, as well as substantial support from healthcare providers, consumers, business, labor, and philanthropy. It is my distinct honor to introduce Ohio Adjutant General, Major General Deborah Eisenhurst. Major General Eisenhurst is a member of the Governor's Cabinet, is responsible for the command of the Ohio National Guard and the military readiness of the Ohio Militia. The Ohio National Guard consists of the Ohio Army National Guard, Ohio Air National Guard, Ohio Military Reserve, and Ohio Naval Militia, totaling more than 17,000 personnel. We are very much appreciative of Major General Eisenhurst's service to the great state of Ohio and to our country, and are honored to have her with us today.
Thank you, Mr. Miller. And good afternoon to everybody, and thanks to Colonel Moe and Major Wilson and everybody else that's here today to show support for Governor Kasich's initiative to expand the availability of health care to those who have sacrificed so much for our state and nation. And as the Adjutant General, I have the privilege to lead and represent over 16,000 of your friends and your neighbors in the Ohio National Guard. And mostly what you hear about these outstanding Ohioans is over the last 12 or so years that they've been deploying in support of our nation's war, the global war on terrorism. And they have done so magnificently, with over 21,700 of those great Ohioans have answered that call to duty so far. And despite what you may hear about the war winding down, we are still deploying our organizations as we speak, literally. You know, when the Ohio National Guard members deploy to support that federal mission, they and their families are covered by TRICARE, the military's healthcare system. And when they return, they no longer have that benefit and only have the opportunity to purchase a much lesser level of coverage through an alternate TRICARE plan. Now, a couple things I need you to understand is to be able to respond to the call of not only our nation, but our fellow Ohioans in the time of a natural disaster or an unnatural disaster, we need our service members to be at a constant state of what we call readiness, which means they are medically and dentally fit and ready to respond without having to have medical care before they go. What I also need you to understand is that unless deployed, the Guard is comprised of citizen soldiers who only work for the Guard during that 1 week in a month and 2 weeks that the commitment is they make when they sign up. And they only get paid from the military for those days of duty, and they do not get any health care benefit for themselves nor their families. Now, if they have a full-time job, they're likely to have the opportunity to be covered by an insurance program through their employer, and even some part-time employers will offer health care options of which our Guard men and women may take advantage. However, some of our soldiers and airmen do not have a full-time job with benefits available to them when they return home from the war. Although they may be eager to work, it may be some time before they can secure a full-time job with benefits. And these are some of our most vulnerable members. We estimate that at any given time, 450 to 550 of our Guard members have no insurance, but would be eligible for insurance under the Governor's proposal. It's difficult to estimate the need because our information is based on self-reporting, and there's no requirement to report if they lose their benefits or if they don't have benefits. But what I can tell you is our most current estimates in just the Army Guard, let's not even counting the Air Guard, but just the Army Guard of over 11,000 soldiers, 3.5% to 5% of the force is single, unemployed, and a little higher percentage of that is divorced and unemployed. Now those numbers fluctuate daily, as you can imagine, but that's why my best educated estimate is 450 to 550 of your neighbors and our friends in the Guard that are uninsured but eligible for coverage under the governor's expansion plan. And there are many organizations, groups, and individuals who care for the well-being of our service members, and they provide support, advantages, opportunities beyond what I could have ever asked or dreamed of. I know that just in my church, Pastor Bob Abrams, who is here in the audience with us today, reached out offering a ministry of support to the military members in our community. And even when he learned about this event today, asked if there's anything he could do to support me in this presentation. Thanks, Pastor Bob. But my point here is that if organizations with no direct affiliation to or any opportunity to benefit from helping our vets and our military members, why would we not want the state of Ohio to provide extended coverage that would benefit these same citizens? The proposed reform of Medicare would offer some relief to those service members who have given so much. On behalf of the more than 16,000 members of the Ohio National Guard, I urge our lawmakers to take action on the governor's proposal. Thank you.
Thank you, Major General Asmus. Health coverage will allow guardsmen and veterans who are at risk physically or mentally to get the right care where they live. I would like to now turn the podium over to Colonel Tom Moe, Director of the Ohio Department of Veterans Services. Colonel Moe, U.S. Air Force retired, continues more than 46 years of military and public service. Thank you. As a member of the Cabinet of Governor John Casey. Colonel Moe.
Thank you, Frank. And it's good to be here again, General Ashenhurst, and we're soon going to hear from Major Wilson. And thank you all for being here today. Nice, cool day and no sun on our face. I like that. Well, we're standing together today to join the call to support Governor Kasich's plan to expand Medicaid coverage for Guards members and reservists and the thousands of Ohio veterans who presently have no option for health care. It is important to note that many people believe that the VA provides free health care for all veterans. This is not necessarily so. For example, if a veteran did not serve during wartime, or he or she has a service-connected injury that's less than 50%, free health care is not provided. The VA does offer copay on a sliding scale for the care veterans receive based on whether or not they served during war, and this is usually restricted to the percent of disability which is a result of their military service. But regardless of the veteran's status or the level of health care he or she may receive from the VA, this care does not extend to their families except in extraordinary cases. So being a veteran does not guarantee access to health care, nor does it see to the needs of their families. If a veteran is unemployed or underemployed without access to other health insurance, these needs become critical. We are particularly concerned if these needs include mental health services. We are seeing an unprecedented number of suicides among our veterans population. Who would deny support to our fellow citizens who step forward to serve their country? According to the most recent statistics, the VA estimated that this ultimate act was taken every day on average by 22 of our veterans nationwide. Most notably, our Ohio female veterans were taking their lives at twice the rate of civilian women. 60% of all veterans who take their own lives are outside the VA health network. They deserve better. We have got to provide the support they need. Well, we have the opportunity to offer these men and women mental health care services and other services under Medicaid, and we owe them as a debt of honor to do it. Offering Medicaid coverage to our veterans would provide health care to an estimated 26,000 men and women across Ohio and to their families. This isn't a handout, it's a handout. Health care to keep this very special group of Ohioans and their loved ones healthy so that they can concentrate on getting ahead in life and enhance their own ability to contribute to our communities is well worthwhile. After all, we're talking about people who left their homes to serve a cause greater than themselves, who stood ready to put their very lives on the line for their country. They're our neighbors, and they're our friends. They were there for us. Isn't it right for us to be there for them now? So once again, thank you for this opportunity to speak to you all today about this important program. I'll turn the program back over to Frank. Thank you.
Thank you, Colonel Moult. It is often misunderstood that all veterans receive coverage through the Department of Veterans Affairs. Only 2/3 of the nation's 12.5 million non-elderly veterans are eligible for VA health care, and only 1/3 are enrolled. A delay in coverage adds to increased costs to our health care system. I would now like to ask Major Victor Wilson, co-chair of the Ohio National Guard Association, to share brief remarks. Thank you, Major Wilson, for your support and continued efforts to advocate for the support of Medicaid expansion for Ohio veterans.
Thank you, Mr. Miller. Mr. Miller has done me right by getting my rank right and everything. I'm following my boss's boss, and Major General Ashenhurst, and so I'll try to add a few things, but very few. And then Director and Colonel Mo, very glad to have you here today. Thank you for all coming. Thank you for caring enough to be here. It is an honor to talk on behalf of the Ohio National Guard Association, and it's an honor to speak for my fellow veterans, my Ohio veterans that are in need. I stand in support of the 26,000 Ohio veterans that would be affected and gained by this Medicare expansion. I also stand in support of the National Guardsmen that do not currently meet the federal or state definition of a veteran that could also be helped by this. This is a safety net for Ohio veterans, and it can be life-saving. The gap Medicare expansion it would cover could make a difference in the prevention of veteran suicides. Once again, I stand in support of our veterans. I ask you to make life better for those that have served. The veterans quite simply deserve your support. I close by saying, this land stays free only as long as the brave step forward to become a veteran. I ask you to stand for veterans too. Thank you.
Again, I would like to thank you for being here today to support our men and women who have served our country in the state of Ohio, who are in need of assistance to get the health coverage they deserve and need. I am hopeful that policymakers will do the right thing for our veterans by extending Medicaid coverage. Over 26,000 veterans, guardsmen, and their families will benefit from this decision. And it is a small price to pay for the service they rendered on behalf of our freedoms. Timing is of the essence. Do not delay. Expand Medicaid today. Thank you very much.